Hello class, good afternoon. So today, this is our nervous system part 2. Okay, muna siya ang utang ko sa inyo last time na wala ko pa na-send. Okay, so, okay. So, di ba nalason ko naman about sa mga white matter and gray matter. So, di ba may kita ginatawag nga white matter. So, ang white matter nga na ini siya, na diri siya nga side. Muna siya ang white matter. Okay, so which is made of bundles of axons and serves to conduct information up and down through the cord. So these bundles are organized into specific groups or functions forming the so-called spinal tracts. Okay, so muna siya ang spinal tracts natin, ascending and descending tracts. Okay, so essentially high-speed cable each carries a certain type of information in a one-way traffic between the spinal cord and a certain area in the brain. Okay, so all tracks occur on both sides, left and right of the cord. Okay, so may kita siyang ascending, as you can see here, pababaw, ascending and descending padalom. So, ang drawing ko ni is ang spinal, ang part sang spinal, pag in-cut mo half ang spinal naton is amunan siya makita mo ang gray matter and white matter. So, okay ha, para mag-gets natin basi matingala kamo kung ano ni siya. So, kung nga gin-cut ta into half aton nga bone sa likod, ang sa spinal cord naton, spinal column naton, gin-cut naton na siya, or ang vertebrae na bala, ang gin-cut natin so muni iya itsura. Okay, so mga start ta sa ascending tract. So, ang ascending tract is conduct sensory information up to the brain. So, di ba pasaka ascending, so up to the brain, while the descending tracts convey motor instructions down to the cord. So, padalom ang descending. Okay? So, sa ascending tract, so may kita dorsal column, spinothalamic, and spinocerebellar. Okay? So, sa dorsal column, fine touch na siya, kag ginatawag nga conscious proprioception. Nahambal ko naman ni sinyo kung ano ang proprioception. So, knowing where you are in your own space. Okay, ang gina-close nyo bilang mata nyo, kag ginaalsan yung kamot nyo, kag balaan nyo, kung diin pakadto ang kamot nyo kung naka-close in your eyes. Okay? So, sa spinothalamic or ang anterolateral is very important when it comes to pain and temperature. So, responsible na siya for crude touch, pressure, pain, and temperature. Okay, so while sa spinocerebellar is the position of body parts. Okay, so proprioception or balance. So, aradang stance, flexion of joints. Okay, so while sa descending naman, okay, sa descending naman tracks is may kita direct motor pathways and indirect motor pathways. Okay? So, sa direct motor pathways kita. Okay, ang direct motor pathways are voluntary and fine movement. Okay? So, may kita under sa direct motor pathways, may kita lateral and anterior corticospinal. Okay, ang ini nga duwa, ang lateral and anterior corticospinal is for conscious motor movement. Okay, ang lateral corticospinal is muscle tone and skilled movements, especially sa hands, ang function niya. While sa anterior corticospinal is, ang function niya is muscle tone and movement of trunk muscles. Okay, so indirect motor pathways naman. So, it is responsible for balance, posture, muscle tone, and coordination. So, unconscious movements naman kita. Dere. So, ang under sina is ang rubrospinal, reticulospinal, vestibulospinal, and tectospinal. Ang spinal is, ang function niya sina is movement coordination. Okay? So, ang reticulospinal, function niya sina is posture adjustment, especially during movement. Vestibulospinal, function niya is posture and balance, and tectospinal is movement in response to visual reflexes. Okay? So, ang cerebral cortex naton. Okay, so muna siya ang cerebral cortex. Okay, so ang cerebral cortex is the outermost layer of the brain. Okay, So, outermost layer of the brain. So, primarily made up of gray matter. Okay. So, ang ginatawag nga sulci or ang grooves, ara siya onan. Muna siya ang sulci. Sulci, muna siya ang grooves ang aton brain. And ang gyri, ara siya dao. Amo na siya ang gyri. Okay? Or ang ridges nga ginatawag. Okay, so sensory areas, sensory areas receive information related to sensation and include regions like the primary somatosensory cortex. So this one, ang violet, is ang primary somatosensory cortex, which process information such as touch, pain, and temperature. Tandaan sa primary somatosensory cortex is touch, pain, and temperature. Okay? So, sa naman kita, primary visual cortex. Okay? Okay, for the primary visual cortex is the primary cortical region of the brain that receives, integrates, and process visual information relayed from the retinas. Okay, so small part lang na ang primary visual cortex. While ang primary auditory cortex, sa primary auditory cortex is the part of the brain that receives and process auditory information or kung anong nababatian mo. Okay, so we have the motor areas. So motor areas of the cerebral cortex are involved with the movement, include regions like the primary motor complex, the premotor cortex, and supplementary motor cortex. Cortex. Okay, so supplementary motor cortex, okay? So, association areas are involved in the integration of information from multiple brain regions. Okay, so this integration can do things like the complexity to sensory perceptions of facilitate higher cognitive areas. Okay, so ara kita ang parietal association and frontal association area. So mga sa cognitive process, ini sa processes. Okay, ang kinmention ko ang parietal association areas and frontal association areas. Okay, for example, the association areas in the parietal cortex are thought to be involved with aspects of course, attention and perceptual awareness, and association areas in the frontal, okay, sa frontal, involve are linked to complex processes like planning, impulse control, and self-awareness. Okay? So, tandaan, sa parietal association, attention, and perceptual awareness, and sa association area sa frontal is planning, impulse control, and self-awareness. Okay? Okay. So, wala ko galit na mention. Sa primary motor complex, located na siya sa posterior. So, ari siya, primary motor cortex located in posterior portion of frontal lobe, anterior to central sulcus, control voluntary movement areas. So, ang premotor area naman natin is located at the front lobe where motor functions are organized before initiation. Okay? So, for the supplementary motor cortex, diri nga part ang gamay, is part of the brain's frontal cortex that is involved in a range of motor and non-motor functions. Okay? So, next we have the motor neurons. So, may kita sang upper and lower motor neurons. Okay. So, sa upper motor neurons is diri kita sa babaw. So, makita nyo, brain, spinal cord to muscle. Okay. Kung sa upper motor neurons, so ga-originate in multiple areas of the brain and brainstem and carry information about desired movement or other responses in descending tracts like the corticobulbar and corticospinal tracts. So upper motor neurons descend to various levels of the brainstem and spinal cord and form connections with lower motor neurons. So lower motor neurons then influence the activity of the muscles or glands. So makita nyo, halin sa babaw, di ba ang color blue na upper motor neuron sa makadto sa spinal cord, then to the muscles or glands na siya. So, sa lower motor neurons naman have cell bodies in anterior horn of spinal cord. So, their axons leave the CNS or the central nervous system and extend through spinal or cranial nerve to skeletal muscles. Okay, so panaog na siya. Lower motor neuron. So, may tatlo kita. So, amo na siya ang somatic motor neuron, special visceral motor neuron, and general visceral motor neuron. Okay, so sa somatic motor neuron, so which extends to skeletal muscle to control movement and muscle tone. And sa special visceral motor neuron naman, which supplies muscles in the head and neck. Okay, ga-supply sang muscles in the head and neck. So ang general visceral motor neuron naman involved in the autonomic nervous system. Okay. So muna sila ang motor neurons ha. So ang upper motor neuron and lower motor neurons, so sila duwa ga-interact with one another to cause movement and other responses. Okay, so upper motor neuron brainstem to spinal cord to the muscle or glands. And ang lower motor neuron pakadto na sa dalom. So spinal to muscles. Okay? Okay, so next we have the basal nuclei or basal ganglia. Okay, so ang basal nuclei or basal ganglia, group of functional related nuclei na siya. So primary nuclei niya sina is include ang corpus striatum or ang deep within the cerebrum and the substantia nigra pigmented cells in midbrain. Okay, so we have the cerebellum. So, ari siya ang cerebellum, ang sadalom. So, ang cerebellum, una siyang regulate movement, balance, and posture. Okay? So, we have the communication between hemispheres. So, commissures. Ang commissures connections between two hemispheres intended to share the received sensory information. So, corpus callosum, the largest of commissures, a broad band of nerve tracts at the base of longitudinal fissure. So, tandaan na ang corpus callosum, largest of commissures. So, we have the right cerebral hemisphere and left cerebral hemisphere. Sa right, so ang sa right side is ga-receive na siya sang sensory input from the controls muscular activity in the left half of the body. So, more involved in functions such as 3D or spatial perception and music ability. Was sa left cerebral hemisphere naman receives input from the controls muscular activity in the right half of the body, more analytics emphasizing such skills as mathematics and speech. Okay? So, sa left naton is puro mga sa skills such as mathematics and speech. Okay. So, sa right naman, na siya mga music. Okay. So, pwede man mga arts. So, sa speech natin has two major cortical areas. So, number 1, ang sensory speech or ang wernickel area in parietal lobe functions in understanding and formulating coherent speech. So, motor speech and bronchi area naman in frontal lobe. Okay, sensory, parietal, motor is frontal lobe. Controls movement necessary for speech. Okay, so next is electroencephalogram or ang EEG. So, do ginatakod na siya sa ulo. You can Google the picture kung gusto nyo makita. So, do ginatakod na siya sa scalp sang isa ka tawo. Okay. So, ang electrodes placed on a person's scalp to records brain activity, electrical activity. So, patterns can be detected as wave-like patterns known as the brain waves. Okay, so sometimes ginagamit man siya sa mga tawo nga comatose if lang taon ta kung may possibility pa ni siyang mabuhi or kung may activity pa bala sa iya brain, di ba nakikita nyo na sa movies sometimes ang mga brain dead nga people sa state nga although sa states ko palang nakita, I'm not sure, may ara man guro kita pero more advanced sila nga nakikita nila if may chance pa or may brain waves pa natatabo inside the brain of a patient. Okay? So kung wala na, then pwede na naton mahambal nga brain dead na ang isa ka person. So may ara kita types of brain waves. So ang alpha waves, normal person is awake but in a quiet resting state. So eyes closed. So alpha waves, so muna siya liwat ha, normal person is awake but in a quiet resting state, eyes closed. Beta waves occur during intense mental activity, have higher frequency than alpha. So delta waves occur during deep sleep in infants and patients with severe brain disorders. So theta waves, common in children, may occur in adults with frustrations or certain brain disorders. So in the beginning of sleep, a rapid transition takes place from a beta rhythm to an alpha. As sleep deepens, progressively more delta waves occur. Okay. So for the EEG, gina-help niya ani sa mga patient nga may mga epilepsy. So nga aga cause ang repetitive seizures na siya. So sa mga may sleep disorders, head injuries, brain tumors, brain inflammation. So ginagamit man ni sila para ma-diagnose kung may ara bala ang patients ang epilepsy, brain tumors, head injury, sleep disorders, brain disease, or brain inflammation tungod sang encephalitis, or herpes encephalitis, or stroke, sila. So, ga-help ang EEG mag-detect sa mga nga sakit. Okay. So, next is memory has 3 stages. Okay, so we have the working memory. So working memory, task-associated memory that is required for immediate performance of tasks. Lasts only a few seconds to minutes, occurs mostly in frontal lobe. Storage limited to about 7 bits of information at any one time. So meaning mga dasigay lang ang memory, like kung may ginaobra kita, study kita, may kuhaan kita, matandaan, tandasig, matandaan, then madula lang na siya dason in seconds or in minutes. While sa short-term memory can retain information for a few minutes to a few days, stored by mechanism involving increased synaptic transmission. Meaning, ang mga mga 1 week ta lang malimtan, then siguro chismis, dasig ta malimtan, matandaan ta pero malimtan taman Japon eventually. Okay? So, ang long-term memory naman, so can store for only a few minutes or become permanent. Okay? Ang mga long-term memory. So, ang declarative memory or explicit memory, so involves retention of facts and related emotional undertones. Ang procedural memory or reflexive memory involves development of motor skills. Only a small amount of this memory is lost over time. And memory engrams or memory trace involved in long-term retention of a given piece of information. Okay, so next is the limbic system. Ang limbic system is part of the brain involved in our behavioral and emotional responses, especially when it comes to behaviors we need for survival. Okay, so ang meninges naman, so muna siya ang protect or wrap around the brain and spinal cord. So ari siya ang blue, daging drawing ko lang. So muna siya ang protect sang aton nga aside pagid sa CSF, ang cerebrospinal fluid, ang meninges ang protect around the brain and the spinal cord. So later, i-discuss ko kung ano ang pwede nga sakit or disorder kung if ever may leak nga matabo. Okay? So, sa meninges, may mga types of meninges kita. Okay? So, the by layer. Silang first layer naton from the outer part or ang superficial is ang dura mater. So, ang dura mater, superficial and thickest layer. So, adheres tightly to cranial bone, consists of 2 layers. which functions as a single layer. So muna sila ang dural folds kag dural venosinuses. Okay? So ang dural folds help, sorry sila nga duwa. So dural folds help hold the brain in place within the skull, and the dural venosinuses collect blood from the small veins of brain and empty into internal jugular veins. And the epidural space sa likod na nisang aton nga spinal. So ang epidural space diri na gina-inject ang ginatawag nga epidural anesthesia. Okay. So usually done sa childbirth para hindi mo mabatyagan ang dalom nga parts ang aton body, ang epidural space. So diri gina-inject ang epidural anesthesia. Okay? So ang arachnoid matter naman, so very thin, wispy second layer. Okay, so ang unders na is subdural space between the dura and arachnoid matter contains a very small amount of serous fluid. So, muna siya. Then, ang pia matter, very tightly bound to the surface of brain and spinal cord. Okay. Next is the ventricles ng brain naton. So, ventricles are fluid-filled cavities of central nervous system. So, may kita lateral ventricle, third ventricle, the cerebral aqueduct, and the fourth ventricle. Ang lateral ventricle, large cavity within each cerebral hemisphere. And the third ventricle is smaller, midline cavity located in center of diencephalon, and the cerebral aqueduct located in the midbrain connects the third and fourth. As you can see, connects the third and fourth ventricles. So fourth ventricle is located at the base of the cerebellum. So continues with central canal of spinal cord and opens into the subarachnoid space through foramina in its walls. Okay. So, muna siya ang cerebrospinal fluid. So, kung sa brain ara na siya diri nga part, ang cerebrospinal fluid, diri may ara man na cerebrospinal fluid. So, ga-cushion na siya. So, fluid na siyang ga-cushion that helps your brain and spinal cord from sudden impact or injury. So, kung may leak gani ang CSF o ang cerebrospinal fluid, kung may matisgra siya, di ba sometimes mauigo ang ulo, maigo ulo ta, mabuka, then malik ang cerebrospinal fluid, pwede magwa sa ilong, pwede magwa sa bakbak. So, muna siya. And then, makos, sometimes, syempre kung may leak na, ang tendency, ma-infect ang meninges na to. Kaya diba, ang meninges, ang ga-protect da sa gwa. Di kung may leak, magwa na siya, will cause meningitis. So, meaning, ang meningitis, ano gayong itis, di ba? Inflammation of the meninges. Ang meningitis. Okay. So, these are the 12 cranial nerves. Okay. So, muna siya ang 12 cranial nerves. Okay. From 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. The 12 cranial nerves. So, ang mnemonic siniha is O, 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 to touch. So, O, 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 to touch and feel. Ang A naton, balis karon ta lang, diba daw A, ang V. So, girl's vagina, heaven. Okay? So, na siya, aray mnemonic naton ha. Ang V lang ding nag-iba. So, ang V, imagine na lang A nga ginbaliskad. Okay? O, 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 to touch and feel a girl's vagina, heaven. So, ang cranial nerve number 1 is olfactory. Ang 2 is optic. Ang 3 is oculomotor. 4 is cochlear. And 5, trigeminal. 6, ang abducens. 7, facial. 8 is vestibular cochlear. Ang 9, glossopharyngeal. Ang 10 is vagus. 11 is accessory. And 12 is the hypoglossal. Okay? So, muna sila ang 12 cranial nerves. So, ang olfactory gani is, ang function niya is for smell. Ang optic is for vision. Oculomotor, for motor movements or motor to 4 of 6 intrinsic eye muscles and upper eyelids. Parasympathetic constricts pupils, thickens lens. Okay, so ang cochlear naman, motor to 1 intrinsic eye movement. Trigeminal, Di ba may mga trigeminal, ang trigeminal, sensory to face and teeth, motor to muscles of mastication or chewing. So may kita sakit man sa trigeminal or ang ginatawag nga trigeminal neuralgia. Okay? So ang trigeminal neuralgia or ang TN, chronic pain condition that causes sudden severe facial pain. Okay. Ano siya? How about the abducens? So, ang abducens, motor to one intrinsic eye movement. Motor to one intrinsic eye movement. And the facial is sensory, taste, motor to muscles of facial expression, parasympathetic to salivary and tear glands. Vestibulocochlear, sorry. So, ang vestibulocochlear, ibaliskad ko lang siya daw A sa mnemonics naton. Hearing and balance na siya. And glossopharyngeal, sensory function niya is taste and touch to back of tongue, motor to pharyngeal muscles, parasympathetic to salivary glands. Okay. So, ang vagus naman naton, sensory to pharynx, larynx, and viscera, motor to palate, pharynx, and larynx, parasympathetic to visceral of thorax and abdomen. And accessory naman, motor to neck and upper back muscles, and hypoglossal, motor to tongue muscles. Okay? So, next we have the autonomic nervous system. So, we have the autonomic nervous system. So, autonomic is network of nerves that handle unconscious tasks like heartbeat and breathing, or mga heart rate naton. So, basic structures niya is ang preganglionic neuron, postganglionic neuron, and autonomic ganglia. So, sa preganglionic neuron, first neuron that innervates from the central nervous system, the postganglionic neuron, second neuron that extends to effector organs, autonomic ganglia, point where the preganglionic neuron synapse with postganglionic neurons. Okay? So, sa sympathetic kita, kag parasympathetic. Ang sympathetic tandaan, fight or flight. Then, ang parasympathetic, rest and digest. Okay? Sa sympathetic, mga alert na tanan. Ang parasympathetic, rest. Okay? So, sa sympathetic, prepares the body for physical activity. Ang parasympathetic, stimulates involuntary activities of body at rest. Okay? So, we have the autonomic autonomic neurotransmitter. So, all autonomic preganglionic, parasympathetic, postganglionic neurons secretes acetylcholine. Tandaan ha? Ang autonomic preganglionic and parasympathetic postganglionic neurons secretes acetylcholine. So, most sympathetic postganglionic neurons secretes norepinephrine naman. Okay? So, amo ni sila tanan ang effects of the ANS on various tissues. You can screenshot this kung wala ka mo sa inyong modules. So, ari naman di tanan ang target, amo ni siya mga organs naton: heart, blood vessels, lungs, eyes, intestinal and stomach walls, liver, adipose tissue, adrenal, sweat glands, salivary, urinary, and pancreas. Amo ni sila ang sympathetic effects and the parasympathetic effects niya. Okay? You can study this one. Okay, so next we have the enteric nervous system. So, consists of plexuses within the wall of the digestive tract. Okay, so stimuli detected by enteric sensory neurons in digestive tract. Next, sent to enteric interneurons that can be override by vagus nerve in parasympathetic and splenic nerve in sympathetic. So, next is travel to enteric motor neurons, then stimulates effector organs in digestive tract to execute the action. Okay, so we have the diseases and disorders of the nervous system. So, ang spinal cord injury, meaning na damage aton spinal cord. Okay, so ang aphasia, absent or defective speech or both comprehension associated with the damage to wernickel and Broca area. So, aphasia, doon hindi sila kaintindi. Doon hindi sila kahambal. Doon hindi sila ka-comprehend na may comprehension issues ang aphasia. Ang subdural hematoma naman, bleeding. Meaning hematoma, blood, may bleeding. Bleeding into the subdural space caused by the damage to the veins crossing between the cerebral cortex and the dural venous sinuses. And hydrocephalus, meaning nagdako ang ulo na, di ba kita nyo na mga bata or patient ka may mga dako ulo. So, possible may hydrocephalus sila. Or may mga tumor mo na. Pero hydrocephalus, meaning niya is accumulation of CSF in the ventricles due to the blockage in openings of fourth ventricle on the cerebral aqueduct. So, usually, ginaspasuyupan ina ang to test kung nakadamo da ang cerebral spinal fluid ta. Okay, sa mga patient ng hydrocephalus. So, may mga hydrocephalus, sometimes ginasuyup ang CSF para hindi na magdako pagid ang ulo or mag-accumulate ang CSF. Okay? So, may ara na gintawag is ang nga shunt surgery. So, ang shunt surgery is a thin tube called a shunt. Okay, butang ko lang di shunt. S-H-U-N-T na ha, shunt surgery. So, thin tube called a shunt is surgically inserted into the brain to drain the excess fluid into the chest or abdomen or sa aton nga ulo. Okay, so the body can absorb the fluid. Okay, so ginabutang na siya sa ulo to drain into the chest or abdomen, ha? Then the body then absorbs the fluid. So may mga ginatawag man kita nga mga medication sang hydrocephalus, okay? So ang pwede na sinang medication is acetazolamide and furosemide. 'Di ba? Ang furosemide para na siya sa mga may sang fluid retention. Okay, so para makuha ang fluid, masikrit ang CSF. Okay. So, kung pabayaan mong hydrocephalus, pwede na siya ma-cause ng brain damage. Okay? So, ang stroke naman. So, ang stroke is known as cerebrovascular accident or ang CVA that results to the death of brain tissue due to disruption of its vascular supply. So, may ginatawag kita nga ischemic stroke and hemorrhagic stroke. So, ang ischemic stroke, diri pa lang, isang arteries nga ga-supply sa brain, tissues naton are blocked. Okay, so naka-block ha sa ischemic stroke. And sa hemorrhagic, meaning hemo, may blood, so naglupok na, results from bleeding of arteries supplying the brain tissues. The encephalitis naman. Encephalitis, inflammation of the brain caused by a virus and less often by bacteria or other agents. So symptoms include fever, coma, and convulsions. So ang iban prone sa ang mga bata, mga ang encephalitis. Okay, so may mga adults naman na nagkakamuni. So depende, case to case basis. Meningitis, ang hambal o inflammation of the meninges. So kung mag-leak ang CSF, so inflammation of meninges, so hindi lang na siyang mag-leak pagid ha. So pwede pagid ang viral or bacterial infection. So symptoms include stiffness in neck, headache, and fever. Severe cases cause paralysis, coma, or death. So, multiple sclerosis. So, autoimmune may be initiated by viral infection, inflammation in brain and spinal cord with demyelation and sclerotic sheaths results in poor conduction of action potentials. So, symptoms include exaggerated reflexes, so tremor and speech defects or ang slurred or ang exaggerated reflex ang gulpi lang ang gapang ang ila reflexes gagulpi lang siya pisik na siya. So Parkinson's disease, so caused by a lesion in basal nuclei characterized by muscle rigidity, resting tremor, general lack of movement, and slow shuffling gait. So ang Parkinson's disease, bakita nyo na doon na pisik-pisik sila, maskin atres sila. Diba? Do gahulag-hulag ila kamo at makita nyo na siya. Kasi familiar na kamo sa Parkinson's disease. So, Alzheimer's disease, mental deterioration or dementia. Ang kakalipat. Usually affects older people, involves loss of neurons and cerebral cortex. Symptoms include general intellectual deficiency, memory loss, short attention span, moodiness, disorientation, and irritation. So, di ba mga lola and lolos natin, usually may mga Alzheimer's or ginatawag nga dementia. So, wala naman yun siya actually bulong. So, do may ara lang ginahelp ng mga supplements para mapadugay ang pag-degenerate sang brains nila or sang neurons nila. Okay? Para hindi sila dasig magka-memory loss or hindi dasig ang symptoms bala sang disease. Okay? So, herpes, family of disease characterized by skin lesions due to herpes viruses. So, in sensory ganglia, different viruses cause oral lesions o cold sores, ang singaw, tama. STD with lesions on genitalia or chickenpox in children. Or ang shingles, yung ginatawag in adults, so daw rashes na siya, ng gabasa-basa, ng tumpok-tumpok. Okay? So, iba ang chickenpox ha, iba ang shingles. So, may pagka-different sila, pero iba sila. Okay? So, may mga ginatawag na herpes zoster, amo na siya nga mga virus. So, muna siya tendency, the rashes na siya nga, laway gid. Okay, sa skin. So, poliomyelitis, so viral infection of the central nervous system damages somatic neurons, leaving muscles without innervation and leads to paralysis and atrophy. And myasthenia gravis, autoimmune affecting acetylcholine receptors make the neuromuscular junction less functional. Muscle weakness and increased fatigue lead to paralysis. So, in short, ang myasthenia gravis or ang MG is chronic autoimmune disease that cause muscle weakness and fatigue. Okay? So, usually, gadrupi eyelid and mouth. So, budlayan na sila mag-swallow or double vision or unsteady ang ilang walk. Okay? So, autoimmune ina siya. So, effects of aging in nervous system. So, sensory functions decline due to the decreasing number of sensory neurons. Okay? So, ang sensory functions naton ga-decline na kung ma-decrease ang number of sensory neurons kung ga-age. So, reduce the senses of movement, posture, position, and control movements, and control and coordination of movement. So, gahinay. Motor functions decline due to general decline in the number of motor neurons. So, notice nyo mga tigulang, hindi na masyado kahulag or kaubra. It's because ga-decline na ang number of motor neurons nila. So, reflexes decline due to slow generation and conduction action potentials and synaptic function. So, brain size and weight decreases. Okay? Okay, so that's all for the part 2 of the nervous system.